style questions focused on gram-negative bacilli that are oxidase negative and produce H2S on TSI agar, particularly shigella and Yersinia, along with 5 answer choices, explanations, and why the others are incorrect, including treatment considerations. Key concepts: shigella gram-negative rod, oxidase negative, does not produce H2, helpful in differentiation from salmonella. Yersinia enterocolitica, gram-negative rod, oxidase negative, can produce H2S, urease positive, grows in cold. Salmonella, oxidase negative, H2S positive, motile. H2S production on TSI, black precipitate. Question 1. TSI agar plus gastroenteritis. A 4-year-old boy presents with abdominal pain, fever, and bloody diarrhea for 2 days. His family recently attended a petting zoo. Stool culture grows a gram-negative, oxidase-negative bacillus that forms black precipitate on TSI agar. Which of the following is the most likely causative organism? A. Salmonella enterica. B. Shigella sonnei. C. Escherichia coli. D. Yersinia enterocolitica. E. Campylobacter jejuni. Correct answer, D. Yersinia enterocolitica. Oxidase negative, gram-negative rod, often linked to animal exposure, pigs, zoo animals. Grows at cold temperatures and produces H2S on selective media. Associated with bloody diarrhea and mesenteric adenitis, mimics appendicitis. Why not the others? A. Salmonella enterica, H2S positive but more often associated with undercooked poultry eggs, not petting zoo or pigs. B. Shigella sonnei, does not produce H2S, also non-motile. C. EHEC, does not produce H2S, no fever typically, associated with hamburger meat, hemolytic uremic syndrome. E. Campylobacter jejuni, gram-negative curved rod, oxidase positive. Treatment, usually supportive, doxychloroquine in severe or immunocompromised cases. Question 2. Cold growth organism. A 7-year-old boy has 3 days of fever, vomiting, and right lower quadrant abdominal pain. CT abdomen is ordered for suspected appendicitis, but shows mesenteric lymphadenitis. Stool culture shows a gram-negative, oxidase-negative rod that grows well at 4 degrees Celsius. What is the most likely organism? A. Shigella dysentery. B. Klebsiella pneumonia. C. Yersinia enterocolitica. Vibrio cholera. E. Listeria monocytogenes. Correct answer, C. Yersinia enterocolitica, mimics appendicitis due to lymphadenitis. Grows in cold temperatures, cold enrichment. Gram-negative, oxidase-negative, and often urease positive. Incorrect choices. A. Shigella dysentery does not grow in cold, H2S negative. B. Klebsiella, not linked to GI illness, mesenteric adenitis. D. Vibrio cholera, oxidase positive, comma-shaped. E. Listeria, gram-positive bacillus. Treatment, often supportive. Severe cases may require antibiotics, doxycycline or fluoroquinolones. Question 3. Shigella and dysentery. A 6-year-old child develops fever, abdominal cramps, and bloody diarrhea. His stool culture reveals a gram-negative, oxidase-negative bacillus that is non-motile and does not produce H2S on TSI agar. What is the most likely pathogen? A. Salmonella typhimurium. B. Yersinia enterocolitica. C. Shigella flexneri. D. Enterotoxigenic E. coli. E. Proteus mirabilis. Correct answer, C. Gram-negative, oxidase-negative, non-motile. Does not produce H2 at no black precipitate on TSI. Bloody diarrhea due to invasion of M cells, Shiga toxin. Why not the others? A. Salmonella, motile, produces H2S. B. Yersinia, may mimic appendicitis, produces H2S, not typically non-motile. D. ETEC, watery diarrhea, not bloody. E. Proteus H2S positive, motile, urease positive. Treatment, supportive. In severe cases, azithromycin or fluoroquinolones. Question 4. Toxin mechanism. A child presents with dysentery and fever. Stool culture shows a gram-negative bacillus that does not produce H2S. The bacterial toxin inhibits the 60S ribosomal subunit. Which of the following is the main mechanism of this toxin? A. Inhibition of cAMP by GI. B. Inactivation of 60S ribosome. C. Stimulation of adenylate cyclase. D. Blockage of GABA release. E. Binding to ganglioside receptors. B. Inactivation of 60S ribosome, Shiga toxin from Shigella, inactivates 60S ribosomal subunit, inhibiting protein synthesis, cell death. Why not the others? A. GI inhibition of cAMP, pertussis toxin. C. Adenylate cyclase, cholera toxin and ETEC. D. GABA inhibition, tetanus toxin. E. Ganglioside binding, botulinum toxin. Treatment, mostly supportive. Antibiotics, e.g. ciprofloxacin, may shorten disease course, but are controversial due to possible Hus risk with Shiga toxin.